Print, email, Facebook, Twitter. More private hospital emergency departments have little impact on easing public hospital pressure. The country's peak emergency medicine organization has welcomed a new private emergency department, ED, but says it will only ease a small burden on the public health system. Buderim Private Hospital on the Sunshine Coast will become the latest to offer an on-site private ED when it opens a 9-bay, 24/7 department in August. The Australian College of Emergency Medicine, ACEM, has advocated for government support to encourage privately insured patients to use private facilities. However, President Simon Judkins said while private hospital EDs allowed patients to bypass queues and access specialists of their choice, the overall impact was limited. I think there is a certain demand for private hospital emergency departments, but we are always just wary that they're not going to be a panacea to the ongoing issues that we have in the public hospital system, Dr. Judkins said. Diverting some of the work away from the public hospital system into the private system does help, but it's a small part of a much bigger solution. Population growth boosting demand. Emergency departments within private hospitals account for about 10% of EDs nationally. Data from the Australian Bureau of Statistics and the ASEM showed that in 2016-17, there were 287 emergency departments in public hospitals compared with 30 in private hospitals. Queensland University of Technology School of Public Health Professor Jerry Fitzgerald said because of Australia's population growth, which is expected to increase to up to 48 million within 40 years, there would continue to be more demand on all EDs. The growth in utilisation of emergency departments is about 2% per annum. On top of that is the extra demand caused by growth in population, he said. The Sunshine Coast faces a similar trend, and demographer Bernard Zalt has forecast the region's population will increase to 550,000 by 2040. Buderim Private Hospital General Manager Wallace Westbrook said it was that growth that was largely the catalyst for the new ED. He said the Sunshine Coast's first private hospital ED would address an unmet community need. As the coast has grown, I think that there's been increased opportunities to offer a service where people can come with confidence, Mr. Westbrook said. He said the ED would treat the same conditions as the public hospital, except major trauma, deterrence, cash and perception. Dr. Judkins said in practice, most patients would continue to access the public ED and health system. Although a private hospital emergency department will help fill a little bit of a void, it certainly doesn't significantly impact the ongoing concerns about the capacity in the public hospital system to ensure the number of patients that present every day to the emergency departments up and down the coast really get timely access, he said. Dr. Judkins said the additional cost of a private ED would deter patients. Unless we can find mechanisms whereby the value add of private health insurance really enables people to access the care they need without that huge additional cost, there is always going to be people who really can't afford to utilize their private health insurance. Professor Fitzgerald agreed, adding that a visit to a private ED usually required an upfront cost of up to $400. We believe that there would be some value in increasing the number of private hospital emergency departments, but of course the reason people don't go there is they're a bit concerned with the upfront costs. Professor Fitzgerald said the perception that smaller, private hospital EDs had fewer resources